But what we want to mention and bring up in this particular talk is that there's an amplifying effect when they occur together. So the amplifying effect of comorbidity is pretty significant when you're talking about ADHD and Tourette syndrome. So this particular graph just really illustrates what I just mentioned in a very nice way. So, you know, if we took Tourette's alone, you can see there's a number of impairments and impacts on life domains with tics and challenges with executive function and attention and emotional regulation. The same can be said for ADHD with impulsivity and distractibility and also emotional regulation. But again, what I like this chart illustrating is that in the end, the two together are really compounded. So the stressors, the behaviors are accelerated or enhanced when you have combined type. So some of the things that we see with comorbid ADHD and Tourette's are increased rates of obsessive compulsive behaviors, anxieties, again, an acceleration or exacerbation of executive functions, distractibility. We do see a higher incidence, and I'll talk more about this a little later, of some maladaptive behaviors related to aggression, anger, rage. And as a result of these stronger behaviors, I'll call them, you'll have increased challenges with social situations. And kids with comorbid ADHD and Tourette's are likely to be bullied than either one. So we know that living in a household with neurodiversity is very different. Daily life is different and it's more challenging than people with neurotypical families. And I guess I want to say that because I want to validate that if you're here because you are a parent or a caregiver of someone with ADHD and Tourette's, your life is different. There are very unique challenges and strains that we're going to talk about. I also want to mention that more recently, word has come out that the challenges and strains on the relationships in a household with ADHD and Tourette's mirror the experience of parents with siblings of children with chronic pediatric conditions. So things like diabetes mellitus, asthma, cerebral palsy. The reason I think that's significant is it hasn't always been the case. Very frequently, most commonly, historically, neurodevelopmental disorders and behavioral health issues were not seen as having the same level of stress or impairment or strain as physical conditions. So I think it's really good that it's being recognized that these are medical conditions. They're just behavioral health oriented versus physical conditions, and they both result in challenges and strains on relationships in a house. But I would add, again, pardon me, I'm just monkeying with my clicker here. I would add that there are some unique considerations or caveats related to the behavioral health diagnoses, particularly ADHD and Tourette's, in that they are both more hidden diagnoses. They're not as obvious. They are very misunderstood. They are conditions whose symptoms include atypical behaviors. And behavior, as we know, is often associated with voluntary control, and misbehavior is often associated with a character flaw, attention seeking, or bad parenting, which we know is not true in ADHD and Tourette's. And as a result of these caveats that I just mentioned, I think that it's fair to say that they are associated with even higher levels of parenting stress. And what we're about to share with you will actually illustrate that. So in fact, this is really interesting to me. When we looked through the literature and the research and we shared some of the different articles we were finding with each other, the unique stressors of these disorders are reported at much higher rates for ADHD and Tourette's than any other condition, which I thought was really interesting. ADHD and Tourette's is more stressful even than chronic asthma, which I also thought was interesting. You might be interested to know that in the case of comorbid ADHD and Tourette's syndrome, it's actually the ADHD stressors that rank highest. So even more than tic severity. And I think that's because ADHD can be a catalyst for negative social interaction. So in other words, families that had ADHD and Tourette's reported on lists of different types of stressors that the highest stressors were associated with the ADHD and not the Tourette's, but that doesn't mean there weren't stressors from Tourette's. So I think also it's fair to say that our lives with our beautiful, wonderful, neurodiverse children is anything but typical. I would venture to guess that most of us were not prepared as parents to anticipate having a neurodiverse child or had learned parenting strategies for how to manage those kinds of challenges in our household. But I do think we may share somewhat of a common story. So it goes something like this. our child is there, they're having some issues, and we're starting to think to ourselves, there's something wrong, or is there something wrong? And then we maybe have started to experience blame, shame, embarrassment about their behaviors, or judgment on our parenting. At which point then we may start looking for someone to tell us what is wrong. In other words, we start the assessment and diagnosis process. Give us an explanation, or perhaps we need to find out if there's a diagnosis underlying these behaviors. I do want to share with you that in our chat group, I oftentimes will have parents that come and talk about how the diagnostic process was really literally traumatic for them. And one of the most traumatic things that occurred to people was getting someone to believe them, that there was anything wrong. And part of that is because when our kids go to a doctor's office, sometimes they can hold it together. Sometimes the symptoms they're experiencing at home aren't expressed there. Sometimes it's a little intimidating, or the visits are short. So it can be difficult to get believed so that people see enough of your child's behavior to understand that they need to work up for a certain diagnosis or explanation. Then the diagnosis happens and you might say, they have what? I know it caught us off guard with our child, because what I understood about ADHD, which I know much better now, was not what I was seeing in my child. And I realized I had to learn a lot more. But so they have what? And then, are you sure? Kind of doubting the diagnosis, wondering if it's correct. But eventually, we have to start moving forward and saying, now what? What do I do? What does this mean for our child's life? And my husband and I kind of coined an acronym a number of years ago called the 4 S's. When we tended to have a lot of friends that were experiencing similar stories as ours, or when I would go to the Chad group. And we call the 4 S's this. So the pattern of the story is that you start with surprise and shock, and then settle. And by that, I mean, you kind of wrap your brain around the fact that there is the diagnosis. And then you begin a search, right? A very dedicated, hard search. You want to get as much information, just hungry for information and guidance on how to manage your child. And you start experiencing the stressors, but more than that, you want so much to learn how to manage those stressors and their impact on our household so that we can succeed in a good quality of life with our kids. More on the 4 S's a little bit later, but just tuck that away in your memory. So in order to understand or enhance our understanding of the impact of ADHD on parents and Tourette's, on parents and caregivers of children that have this comorbid disorder, we need to identify and really explore multidimensional stressors that exist with these two problems comorbidly. And the reason is it's really important for us, critically important, in fact, to understand how parental stress then is linked to adverse consequences in our household. And we see that, as I'll describe in a few moments, impacts on parents, children, family function, and even parental stress can exacerbate the symptoms of ADHD and Tourette's, and or make them less responsive to their treatment. So parental stress has a very significant adverse impact on family function related to their comorbidity. So when you talk to different authors, they categorize the family stresses into 2 categories. One is general stressors, and those are things that transcend the diagnosis, meaning anyone with a chronic pediatric serious condition will experience these stressors. And then there are the disorder-specific stressors, and those are the unique features of the disorder that are inherently stressful. And the 2 of them together then are combined to form parental stress. So let's get a little more into the details. Starting with the general stressors. Again, this is what anyone who has a serious chronic medical condition, whether it's behavioral or physical, may experience. And that is, first of all, increased caregiver burden, also pervading fear and anxiety, the need for protective management, because we have to then be very vigilant, especially when it's a chronic condition. We have to anticipate what's coming down the road, what we might need to modify or adjust. Basically, we're always staying a step ahead of the game, right? To stay on top of things for our children in our house. Also, there's the impact of what they call critical times or events. So these are changes for our children in how their condition mixes with developmental transition changes, or events like moving from 1st grade to 2nd grade, moving from middle school to high school. We know that that transition can be very much impacted by their underlying comorbid diagnoses. And so we want to pay attention to those stressors at those critical times Also, family life events like death or divorce are other critical period times where our kids with these comorbid disorders will have increased taxes on their function. Lastly, social isolation. And I think Jeremy's actually going to talk a little bit more about that when we get to her section. And now here we have just a chart of some of the disorder-specific stresses common to ADHD and Tourette's, and they're categorized by factors that contribute to stress that are from the parents, from the child, and from the illness theirself. So parental factors that contribute to stress are the stigma and the stereotyping that exists with both of these conditions, which leads to lower levels of acceptance and a pretty considerable amount of misunderstanding, and that directly impacts support, right? Also, this is really interesting. Parents often experience remorse at their ineffective parenting, and this can be pre-diagnosis or after diagnosis. So I oftentimes will have parents, as we're talking about kind of a primer on ADHD or Tourette's, come forward to say, I feel so guilty, sometimes even in tears. I didn't know that that's what was going on. I didn't realize this behavior or this symptom was part of their condition. And my punishment was harsh, or I believed that they were doing it intentionally or on purpose, and responded accordingly. And I always say, when you know better, you do better. And I think Jeremy, again, will be talking a little bit more about forgiveness as a coping strategy to this stressor. But that's the pre-diagnosis. Then there's the post-diagnosis remorse. And that's when you start to learn these parenting strategies and techniques. And you kind of think you got your game on and you mess up. You have a day where you don't hold it together. You have a day where you don't respond appropriately. And so you start to experience guilt and remorse because of your lack of effective parenting afterwards. You also get the experience of you're trying techniques and strategies that you've learned and they don't work. And I can't tell you how many times I've had parents come up and say, I don't know what to do when my best isn't good enough. Just feeling that tremendous strain and stress from that. And then lastly, there is expressions of guilt related to the genetics, as both of these conditions are highly heritable conditions. The child factors that contribute to stress are, as we know, the behavioral, social, academic, and emotional difficulties that kids experience. Also the comorbidity. Both of these conditions are not only highly comorbid with each other, but with other types of comorbid problems. So for example, Tourette's is comorbid with ADHD, OCD, sleep issues, depression, migraines, and even physical issues or trauma from severe tics. ADHD is commonly associated with learning disabilities, mood disorders, dysgraphia, dyscalculia, always pronounce that wrong, and also oppositional defiant disorder. So a lot of comorbidity that adds to the stressors. Also, trying to manage other people's responses to those behaviors is a factor that contributes to stress. I think most interesting is really the illness-related factors. And the reason I say that is when I was reading through a lot of these, was like, I went through that. But at the time, even though I was stressed, I didn't cognitively target it as that was a stressor. And when you look back and you were experiencing these things, they really are very stressful events. So the first of those being the mistaken or delayed diagnosis of the child. Again, we know that behavioral health diagnoses oftentimes overlap. We have a lack of specialists or access to services in behavioral health across the country. And so it might be very, very difficult to get an accurate diagnosis or to have them tease out the different comorbidities. So that's very stressful. Also, the waxing and waning of symptoms. And this can be expressed in a couple different ways. One of them is that they're not always there. So we have this kind of inconsistency in the symptoms being expressed. And depending on what it is, it might be a factor where somebody thinks that they can control it because it's not there all the time. When in fact, we know in both conditions, a lot of the issues are under their own voluntary control. Next, we have, this was the unknowable prognosis. We all worry about our children's future with their conditions. And then this next one, it's twofold, the lack of specialists and the lack of treatment options. Parents long for solid, good information and readily accessible information, and providers who understand their child and understand the diagnosis. They also want good and effective treatment, and the lack of these for both ADHD and Tourette's is very stressful. Now, fortunately, I'd like to add, my child was diagnosed, I think around 2003, so we're almost getting on 20 years now since diagnosis. And I would just like to say with my hindsight that looking back, I really think we have done such a better job, at least with ADHD, in specialists who are better trained and in treatment options and management. We still have a ways to go, right? But that's been my experience. In terms of behaviors, one of the other stresses that parents frequently report is detangling. In other words, when you have a child expressing a behavior or having an issue, is it their condition or is it just normal parental or childhood misbehavior? And that can be really difficult and stressful to try to figure out on a day-to-day basis. If you are in a household with any of these behaviors, which by the way are very common with comorbid ADHD and Tourette's, you are at a significantly higher level of stress and have more adverse outcomes occurring in the household. And so what we're talking about here is self-injury, aggressiveness, episodic rage, impulsivity, very severe tics, and multiple comorbidities. And it's because these behaviors cause daily disruption and conflict in the household. They are emotionally and physically exhausting, and there are higher levels of adverse outcomes socially and within the family. So just something to keep in mind, that if you are experiencing these and you think that your household is very chaotic, it is because these are more difficult behaviors. So don't feel like it's not because you're not managing things well. These are really challenging behaviors to deal with. So that leads into my next slide. These things are hard. And the quality of life for parents who are experiencing these factors and these stressors is consistently demonstrated as being impacted or altered. It affects our kids, it affects us as parents, it affects our whole family. So we are talking about quality of life issues. And the reason for that is parenting a neurodiverse child does impact everything. Neurodiversity changes the landscape in a household. And so I'm going to switch now from what the stressors are to what some of the impacts of those stressors are specifically on the parents in the household. So because of those stressors, we see higher caregiver burden. And this is even in households where you have supportive partners. So even with a supportive co-partner or co-parent, there is higher caregiver burden, usually assigned to one, typically the mother in a household. They express that they feel forced to act as an advocate and an expert, which is stressful because they have to stay on top of the information and the knowledge, and they have to get out there and inform people. Most will say that they're willing to do it. It's a labor of love, but it doesn't make it any less stressful to do. We also know that higher caregiver burden makes it very difficult with your home activities, just completing simple household tasks. I remember days where it was hard to get a meal on the table because I was too busy managing a child's behaviors or running them to appointments or picking up medications. That's just a small sample of some of the issues related to caregiver burden that then impacts your ability to manage household tasks. Also, parents will develop more negative coping skills. They will have increased physical chronic health issues such as sleep disorders, ulcers, hypertension. They'll also have behavioral health issues like anxiety, depression. There is a higher incidence of substance use disorders among parents with comorbid neurodiversities. And there are some other addictive behaviors that are reported, such as gambling addiction, addiction to internet or shopping, things that increase the dopamine in your brain so that you feel some relief from the stressors of the day. Also, parents with comorbid neurodiversity, especially ADHD and Tourette's, tend to have one parent, at least in a two-parent household, that leaves the workforce, again, usually predominantly the mother. So their occupational domain of their life is also affected. They also have difficulty maintaining normal social life. And this can be related to two things. It can be either self-imposed in that I'm too tired, I'm too exhausted, I'm too embarrassed, I'm too frustrated about the judgment. Whatever it is, I'm just not going to reach out and maintain my social relationships. Or there are also reports of it occurring because of stigmatization. And I saw a lot of qualitative studies that had quotes from parents that went something like, you know, it just became really obvious that no one wanted to be with me or my child. And that's really painful. Parents of kids with comorbid ADHD and Tourette's have lower self-concept, lower parenting confidence, lower self-efficacy. They live worried because they're staying in the day-to-day struggle, which makes it very difficult to have optimism. They experience chronic stress, anxiety, and fear. And sadly, also experience a higher level of marital difficulties and are more likely to divorce than our neurotypical counterparts. Not only does ADHD impact the parent individually, socially, occupationally, relationally, but it also affects one's parenting. So let's talk a little bit about the parenting responses to those multidimensional stressors. If you're parenting a child with comorbid ADHD and Tourette's, you are stressed, and the more symptomatic your child is, the more stressful you are. As we already mentioned, ADHD and Tourette's in children can have significant repercussions on self-fulfillment and psychological well-being for parents. It's not just a nuisance or an irritation. These are significant, real challenges and stressors on parents. Parents then are more likely to overreact to misbehavior. They use fewer positive reinforcement strategies, and they exhibit harsher discipline coupled with lower warmth. And this is a problem, this authoritative type or more reactive type parenting, because it impairs the parent-child relationship, not only with the affected child, but with the siblings in the household. And so ultimately, it increases levels of overall family stress. So you start to get into a spiral. So we have stressed out parents. Again, I think it goes without saying that raising or parenting children with comorbid ADHD and Tourette's can have a huge impact on psychological well-being of a parent. And I think we need to say, you don't have a typical child, therefore you can't parent typically or run your household typically, which we'll get into in the second half. So there's an important point for me bringing this all up. You know, I just kind of focused on a lot of negatives, a lot of scary stuff about stressors related to comorbid ADHD and Tourette's syndrome. But I want you to think about, once again, those 4 S's. Again, looking at especially our searching, our seeking, and trying to live with the stressors so we can succeed. And the reason I'm bringing that up is you're here. You're here at this webinar. Thank you so much for being here, because the story is that you are here searching, seeking, learning, and moving forward because you want to strive for success and the best quality of life for you and your family. And so that brings me to the concept of centers of excellence. And a center of excellence is an established medical program. It's granted recognition by the Tourette's Association of America for offering the highest level of care. And what they mean by that is leadership and excellence in training, in education, and in advocacy, in this case for Tourette's. And Jeremy and I talked a lot about that. And we talked about, as parents, that story of going through, getting over our shock so that we can start searching, start looking. We are actually working towards our own level of excellence, and excellence. And let me talk a little bit more about that. I want to share with you, over a course of several years, I often would run a survey by my parents that came to our chat group. And I asked them to rank in order their top 5 definitions of what would be considered excellence in the care for their child with their disorder. And they looked at features and characteristics. And over time, I kind of distilled them down into a ranking list. And this is what they said. In order to be considered in their mind excellence, the providers needed to know and understand the diagnosis. They needed to be able to accurately and quickly, I might add, assess and make the diagnosis. They needed to have enough knowledge to explain and help others understand the diagnosis. Be well-versed in best treatments, so medications, therapies, and approaches. And especially when and how to tweak that, to know how to do that. Or if they didn't have the expertise, to be able to refer to others that did. They wanted their providers to be proactive in helping them have a heads up that's coming down the pike, so that they could adjust to meet the needs of their children at various developmental points. One of the things that came up quite often was adolescence and the hormonal changes in girls and the growth changes in boys that sometimes affected medication effectiveness, both in Tourette's and in ADHD. So just having a jump start on that and getting ahead of that. Again, a range of resources and referrals, and they wanted their provider to care about their child and family. So over time, I categorized a lot of their different responses. What people are looking for is empathy, knowledge, competency, currency, so being current and up to date, and connected to resources and referral sources. So here's a quote I'll share with you. A worried mom does better research than the FBI. And again, backing up to that story of those of us, oftentimes as families, are engaged in intense search and looking for answers for our kids. And I want you just to look for a moment at these features that parents, identify as signs of excellence. And I want you to stop for just a moment before we move into strategies and ask yourself, how many of you have spent time, emotion, money, or energy understanding your child's diagnosis, getting enough information to know whether or not your child is accurately diagnosed or assessed, or if you felt that there was maybe something not quite complete about that diagnosis, going back in for a more thorough diagnosis? How many of you acquired a knowledge base such that you could explain and help others to understand your child's diagnosis? So whether that be their teachers, their coaches, family members, siblings. I'm quite sure that most of you, when your child was given a medication or therapy was recommended, that you went and researched it up one end and down the other. So you are probably very well versed in the best treatments for your children. I know that you're proactive in addressing issues and looking ahead, staying ahead of the game. What do I need to tell the coach? What do I need to make sure is in place before they move on to the next class? What needs to happen when they go on their field trip in terms of medications and so on? You hopefully are developing a range of resources and referrals, and I definitely know that you care about your child and your family. So what's my point in all this? You either are or have become the center of excellence for your family. And I really think after looking at all of this scary stuff, it's also time to sit back, take a look at yourself and your family, and really appreciate the strengths that you have shown. So this is a quote I got. Actually, this is from our presentation bio. Through necessity and commitment, parents of kids with neurodiversity end up creating their own centers of excellence within their family and community to ensure that their kids get the resources they need. So once again, really important that you look at your strengths and all that you have accomplished. And you add another dimension. It's important that we have these medical centers, but you as parents, caregivers, add a whole different dimension in that being a center of excellence is not just about acquiring knowledge. It's not just about education and expertise, because our experts can provide knowledge, advocacy, treatment, and resources, but only you can provide the love that goes along with this. And I would say that love, supported by your own education and research and expertise, can do a lot. We must see what love can do with our kids, and it can do a lot. And so what I'd like you to do at this time, 3 things. First of all, acknowledge the strengths that you have shown in the face of these multiple dimensional stressors that we've just gone over. Also, I want to take a moment to virtual high five like that to you all for your excellence. Thank you, Jeremy, for your excellence towards your child and your household. And lastly, as we move forward, never underestimate the power of a mom and a dad, or a caregiver, a foster parent, a grandparent. So with that, I'm going to hand it over to Jeremy to tell you how to be your center of excellence.
That was awesome. I am super pumped and ready to rock ahead. You're going to have to drive for me though. Okay. Okay, cool. Okay. So key takeaways from the first half, right? Parenting kids with ADHD and Tourette syndrome can be very stressful. We're very stressed out. Parents with ADHD and Tourette, all kinds of life impact. Now, what do we do about all that? So Jane, if you can go back one. The first thing that we want to do is build a support network. And the reason that we want to build a support network, go to the next slide, is that parents, go back one, thank you. Parents who have strong social support have decreased levels of stress, decreased depression and anxiety, an increase in physical well-being, and an increase in overall quality of life. So strong social support matters. And what does social support look like? Well, it can be all kinds of things. It can be immediate family, extended family if you have it, community support. If you live in a rural area, I know it's hard to make it to a support meeting or start your own support group. You can join lots of things online. Sometimes it's just that nice neighbor that's willing to watch your other kids while you take your kid that has Tourette and ADHD to the doctor. Whatever some community support looks like for you, you're probably doing a great job already, but it's a good idea to expand that. Go ahead and go back just a little bit more. Just I want to finish on that slide. Thank you. And then within the school too, I mean, we can't underestimate the power of having a supportive teacher, a supportive administration at school, of your child's classmates and friends. All of those things help make our lives better and bigger and easier. So if you're not already doing this, and I think most of you are, otherwise you wouldn't be on this call, but strong social support can be a huge help. Okay, next one. Here we go. Partner with your parent. This can be kind of challenging sometimes, right? Because I don't know about you, but I don't always like my co-parent. Sometimes I don't think he has the best ideas. I don't have the best ideas. Sometimes we disagree about what consequences should be, or if there should be consequences. Sometimes we disagree about if one of our children's behavior is the result of their neurodiversity, or if they're just being jerks. And so it can make really challenging sometimes to partner with your co-parent. But that's also important. I think Jane mentioned earlier that your relationship with your co-parent or your partner can impact your child's symptoms. It can make them worse. And it can also increase lots of things. Go ahead and go to the next slide for me, Jane. So one of the studies I looked at recommended dyadic coping, which is just a fancy word for interpersonal stress management in couples. And basically what that is being able to recognize when your partner's stressed out. And usually you need to recognize if they're stressed out from like a physical perspective or a verbal perspective. I don't know about you guys, but there have definitely been times in my parenting of our 5 children where one of us have come up and just said, I'm done. Take this kid, I'm done, I'm walking out, I need to walk out right now, I'll be back. And, you know, more often than not, and actually we've been pretty good about this one, the other parent takes over. And, you know, we don't do it often, but when we do have to kind of pull the I'm done card, the other parent, you know, jumps right in and provides support. And so that's a key piece of successful parenting or successful co-parenting. Because real or perceived support, so your partner doesn't even have to actually give you support. As long as you feel like they're supportive, it dramatically can decrease your stress overall, which decreases your child's stress, which decreases family stress. Next slide, please. So be a lover, not a fighter. As I mentioned earlier, your relationship directly impacts your child's future. It can make all those primary risk factors heightened, basically. And I know sometimes it feels like we're to blame for everything, but this is one area where if you're able to partner with your co-parent or maybe do some couples therapy or, you know, whatever your relationship is with your co-parent, if you're a single parent, I guess you could take this one off your list. No, I'm just kidding. You know, I'm sure you have other people that you have to coordinate with. And the better that we can do in terms of communication with each other and in terms of improving our communication and parenting skills, the better we can do overall. So next slide, please. Emotional regulation. Yeah, this is a tough one, right? It's tough for our kids. It's tough for us. I know I mentioned at the beginning that we have 5 kids. My daughter has Tourette and ADHD, and she was diagnosed with both a little bit later. And her brothers all have ADHD, and they're the ones that struggle the most with emotional regulation. But not surprisingly, her parents struggle with this as well. Go ahead and go to the next one for me, please. So emotional regulation, what are we modeling? You know, there are definitely times or have been times, and I say this in my parent groups, you know, where I'm really glad that we're not on a reality TV show, because if someone were recording some of the things that we had said back in the early days, we would be horrified. So I call myself a recovering yeller, and I've done a lot of work, a lot of parent training, parent coaching to learn how to recognize when I'm getting triggered. And just like I said earlier, you know, to say I'm done, to walk away, give myself time to calm down. And then once I've calmed down, I have to make sure I'm calm, coming back and apologizing, you know, and even if we can't control our emotions all the time, if we lose our temper, I think the most important part is, of course, coming back and apologizing and modeling what it looks like to apologize. And then forgiveness. And Jane mentioned earlier, but forgiveness is a huge part of what we do. I think it was Russ said in one of his other presentations this year that, you know, we have to learn to forgive ourselves first and foremost. We have to forgive our child, our partners, our co-parents, our extended family, you know, grandma and grandpa who just don't understand why we don't do X, Y, Z to get that kid in line. Sometimes we have to forgive the school. for not knowing, extended society, the lady in the grocery store who comes up and shares her opinion. There's a lot of forgiveness that we need to practice. And that's really important. And that goes along with the next thing that we're going to talk about, which is mindfulness. And so mindfulness, this is something that I run kicking and screaming from. Mindfulness sounds like torture to me, and I don't want to do it. And I didn't want to do it until I went to a lecture by Mark Burton. So if you go to the next slide, please, Jane. Mindful parenting helps reduce parents' reactivity to their children's behaviors. And I need that. I need to be able to reduce my reactivity so that I don't have to, excuse myself from the situation quite as often. And again, if, we can work on mindfulness and use that as a tool to decrease our reactivity, that decreases our overall stress, and it helps us feel more confident and in charge to some extent, and like we kind of know what we're doing, which I don't know about you guys, but a lot of the time I don't know what I'm doing. And so if I can practice some things that will help me feel more like I have an idea what I'm doing, or at least I'm calm about it, then that's going to put me in a better position to be successful. And so mindfulness is actually pretty simple. It's not sitting and meditating. It's not keeping your eyes closed and, going for 15 minutes. And the most important part for me is that it is not like a complete absence of thought. It's, your mind is going to drift. You're going to have thoughts. The important part is that you just kind of bring your thoughts back to whatever it is that you're trying to focus on. And really, it's just kind of an awareness and acceptance of what's happening. I'm upset. I'm recognizing I'm upset. I'm going to sit here for a second and feel upset. Why am I upset? Kind of working through this mentally while trying to stay in a calm place, and then intentionally choosing what comes next. So I've come to this space. I'm upset. I feel more calm now. What might also be going on? And sometimes we say, telling yourself a story that may also be true. Goes back to that naughty versus neurological piece, where sometimes we'll say, well, he's just doing that because he knows that you're going to give him XYZ at the end. Yes, that may be true, but it may also be that he's doing whatever behavior because he really doesn't have the skills yet to do the behavior that we're asking him to do. And so I can use mindfulness to help get to that place, and that helps me calm down and have more empathy for my child, and then come to them with more sympathy, basically, and more of an open mind and an open heart, and working towards a path forward instead of staying in anger. And so that is what mindfulness is. At least that's the way Mark Burton explained it to me a couple of weeks ago, and it really resonated that time. And I've sat through lots of lectures on mindfulness, and this was the first time that I thought, I can do that. And so if I can do that, for a minute or 5 minutes a day, I'm pretty sure anyone can do it. It's just a matter of finding the mindfulness director that works for you. Okay, next one. Self-compassion. Self-compassion is also a bit about forgiveness, but it is one of the significant factors in reducing parenting stress. And so if you needed a definition of self-compassion, it's the management of emotions by emotionally positive self-attitude to protect yourself from harmful things and self-assessment, isolation, and contemplation in the form of depression. And so being able to manage your emotions or give yourself some self-compassion helps you avoid being depressed. I think a lot of that is tied to forgiveness. If you go ahead and go to the next one. But it's also a little bit about kindness, and if you use mindfulness as part of your self-compassion practice, you're recognizing that, okay, I'm upset again. And this is a moment of struggle, as Dr. Burton says, and everyone struggles with something. And that's true. I think we're pretty good at, as parents of kids with neurodiversities at, perspective shifting. When someone else's kid is melting down in the grocery store, we're probably the first parents to go, oh, that poor mom, or oh, that poor dad, or oh, that poor kid. We're probably, one of the last people to be like, oh, bad parenting or something like that. So we recognize that everybody struggles with something because we are struggling with something. And I think this part is important too. May I treat myself the way I treat my best friend in this moment. May I find strength and ease. May I be kind to myself. And this comes from, again, it's that perspective shift, but it's also a lot of times when I have clients and parents that I work with that are being really hard on themselves. I asked them, what would you say if your best friend was sitting here and your best friend was saying all the things about themselves that you're saying about yourself? What would you say to them in that moment? And, 100% of the time, the client will say something like, oh my gosh, I tell them that's not true. I tell them they're fabulous. I tell them that, of course, they feel stressed out right now. Anybody else would feel stressed out right now. I tell them it's going to be okay. And yet we're completely unable a lot of the time to give ourselves that self-compassion and grace. So I think that piece is important too. All right, the next one is exercise. Yeah, exercise. There's tons of studies that talk about how exercise is better for us and for our kids. And if we exercise, it's the equivalent of, it can be the equivalent of a dose of stimulant medication for kids and adults who have ADHD. And it helps reduce overall stress. It's something we know we should do anyway. Go ahead and kick forward, if you will. And, anytime I go through one of these lists of like techniques and ways to help, my first response is, oh my gosh, you're just giving me more stuff to do. And I'm already stressed out. Didn't you listen to the beginning of the talk? How am I going to do all these things too? So what I want to stress too is that, we get it. Jane and I have both been there. I still have kids at home. We're still in the thick of it at our house. And we know you can't incorporate all these things because you're stressed out. But if you can do one small thing, lots of research shows that even if one parent, one co-parent, one partner, one person can make one tiny change in their approach and their behavior and their routine, then it changes the entire dynamic and it creates this ripple effect. And if you choose to do one thing that's maybe more than one small thing, kind of declaring your commitment, it's that whole theory of like, I'm going to meet somebody at the gym to work out, or I'm going to go to the support meeting, and just letting people know that you're planning on doing it, because then you're more likely to follow through with that. Because I get it. I know I'm supposed to exercise every day. And do I exercise every day? No, but sometimes I do. And, if you can set yourself up for success by either putting yourself on the hook through, some people do it through social media. I don't like that one. But just even saying sometimes I'm going to be home late because I'm going to stop at the gym or whatever. I'm going to go to the parent support group meeting, or I'm going to join online, whatever you can do to kind of shift the needle just a little bit, that's going to make a difference. Okay, go ahead and jump ahead to psychoeducation, if you would. Psychoeducation is learn neurodiversity and what that means. And I put ABC, always be curious. I was thinking about Glenn Ross for some reason, always be closing, and changed it to always be curious, because, there's always new research coming out on ADHD. And it's easy to forget sometimes that, our kids, especially when we've had like a period of calm, particularly now with the medication shortage, lots of clients who've come in and been concerned about their kids because their kids with ADHD were being really impulsive, and we're having trouble controlling their emotions, and we're having trouble with organization and executive function. And, I felt kind of silly, but I was like, those are all the symptoms of ADHD. And, your child has ADHD and isn't medicated for it right now. So of course they're exhibiting those symptoms. So, continue to remind ourselves what ADHD looks like, what Tourette looks like, and that some of the behaviors we're seeing are just the baseline symptom presentations of those conditions is an important thing. Go ahead to the next slide. Also important about psychoeducation, right there. Yep. So just knowing, validation is hugely important because it reduces stress. It helps, reduce or prevent the relapse of ADHD symptoms. ADHD, then you're going to take the medicine, and that's going to help prevent the relapse of symptoms until there's a medication shortage. But, just knowing and being confident about what you're seeing is actually real, and validating, like I said, improves competence and confidence and normalizes our experiences and sets us up for success. I know I'm going fast. I'm trying to get a couple more slides in before we get to the end, so you guys have time for questions. So bear with me. This is my own little thing. Substance use disorder. Jane mentioned earlier that parents of kids with comorbid Tourette and ADHD are highly likely to abuse, alcohol, drugs themselves. We know that kids and adults with ADHD are at high risk for substance use disorder already. And, a lot of times our kids are diagnosed well before they are going to be exposed to the drugs or alcohol. And so it's critically important that we talk to them early on about what that means. Go ahead to the next slide, if you will, because we already know that individuals with just Tourette syndrome alone are 7 times more likely to develop a substance use disorder at some point in their lifetime compared to their neurotypical peers. And individuals who have both ADHD and Tourette syndrome are between 10 to 15 times more likely to struggle with addiction of some sort in their lifetime. And so why do we wait until they start drinking or using drugs to talk to them? Start now, because, if nothing else, make them aware that they're at risk and tell them why. There's all kinds of programs online. Schools have programs, and we can talk more during the chat if we need to about what some of that education looks like. But these are scary things, and I don't know about you, but that stresses me out almost as much as everything else. The thought of, 10 to 15 times, that's crazy. So anything that I can do to head that off, or at least let my daughter know of the risk, and she does. We've talked about it off and on many, many, many times. I come from a family of people who've been, challenged with substance use disorder. So we know that it's genetic, and we tell our kids all the time, at least 3 of the 5 of you are probably going to end up addicted to something, unless, and then we tell them the unless. So they're fully aware. Next slide, please. Never too late. Critically important. Oh, go ahead. We can skip that. Okay, so one of the other key takeaways I think that Jane and I would both like to kind of drive home is that, there's very few prognostic indicators for successful outcomes. That means, we don't know for sure necessarily if we do this, that your kid with ADHD or our kids with ADHD and Tourette syndrome are going to be successful. But throughout all the literature, one thing comes through loud and clear, and that's the emotional health of the primary caregiver. So the best chance you have to give your child a successful life is to make sure you're taking care of you. Okay, so in summary, take care of you, exercise when you want to, or declare your intentions. It's okay to take a break from your child. I think that's a really important one, particularly when your kids are young, because we tend to take a lot on, and then we feel guilty about taking time for ourselves. And we're really good about putting ourselves last, even though we know all the stuff about self-compassion. Your emotional health is the key element of your child's future success. We still put ourselves last. So continue to learn all that you can about ADHD and Tourette and parenting stress. And it's okay to it's okay to go to the gym. It's okay to take 30 minutes and watch some Netflix. All of those things are contributing to you being a healthy parent and better for your kids. Oh my gosh, is it 6? I'm sorry. Okay. So we love this slide. You and your home are the center of excellence. You guys are excellent already. Continue to be that for your child and for your family. Thank you so much for being here with us today. And since Jane and I are okay to hang around a little bit after 7, because I know that, we're only supposed to go for an hour, but as usual, we had too much to say.
You guys are fantastic. Thank you so much. It was a lot to say, but it was such great information. And we're so lucky to have this today and to have this recording so we can keep this in our future files. Thank you so much. I too am a parent of a child with ADHD and Tourette. And, all these years, this is like the gold you have given. So thank you so much for this. I put a few resources in the chat, a few that you'll really want to make sure you access is one resource was developed through CHAD and the Tourette Association, and it's about ADHD and Tourette. And the other is called Emotional Overload, Understanding Non-Tick Related Behaviors in Tourette Syndrome. And that is a resource that has been developed in the last few years, and it will piggyback very nicely onto what both Jane and Jeremy have had to say. So like they said, they are happy to take questions. We have a few in our panel. I did talk to them ahead of time. They are happy to stay on. So I know I want to let all of you know that it's 2 minutes before 8 o'clock, but they are happy to stay on past 8 o'clock. Please do so. And please don't leave without answering our survey. Of course, we want all the great feedback about Jeremy and Jane. We also want to know what we can bring to you in the community. And there's all kinds of great questions. It's only 2 minutes. There's a link in the panel, and you can actually fill out the survey while you listen to the questions and answers. So again, thank you, Jeremy and Jane. And I am going to begin by reading off. There's been some really great questions. So here's a question with what Dr. Indegard is talking about regarding researching the diagnosis. It's also hard being a parent that is a psychologist, clinician, or other related professional that has knowledge as well. Do you have any tips for people that also live inside this kind of a profession and have neurodiverse children.
That's a great point, a very great point. And my experience with that, of course, is as a nurse, I tend to not tell people I'm a nurse when I'm going in for care because they get too intimidated or whatever. But I certainly wouldn't do that as a psychologist or psychiatrist going in. You want them to know. But I don't know that I don't know, Jeremy, if you have any other tips that you would do, but I think just staying open and realizing your role, where the boundary is, what your role is there is as a parent. But certainly your knowledge is important and it's critical, and perhaps gives you an advantage in some ways of understanding more of the information coming your way. My guess is it would be a bigger challenge if you know more than the person too, but I'm going to turn it over to Jeremy for any comments.
No, I don't know that I have anything to add, except that when I read that question or heard that question, my thought was about how easy it is to kind of, access research and get down the rabbit hole with some of these things. And sometimes I need a reminder to turn that side of my brain off and just go to like normal mode, whatever that looks like. And be open to other suggestions and other opinions. It is kind of nice to be plugged into, your local mental health community and know, who the experts are in your area, so you can call on them if you need to. So there are some benefits to that piece.
Thank you, both of you. I have to say, I'm getting all these comments that the chat is turned off, and I know we've used the chat in our webinars before, so I'm going to have to look at that feature. So what I'll do is, I was going to follow up with an email to all of you with a recording, but right after this, I have everybody's email. I'll follow up with the survey and the resources that I mentioned, because I know when it's fresh, coming right off a webinar, that's when you're more likely to look at it. So I will follow right up with that. My apologies. Here's another question. It's very beneficial information. Can you share the information again about the statistics of parents who have changed professions or stopped working? If you don't mind sharing that again. They're saying our family has needed to utilize FMLA, and it can still feel impossible to both work. And they also wanted to let you know it's very validating information.
I'm glad that it's the case in our household. I don't have the actual statistical numbers. It's much higher than our neurotypical counterparts. I could certainly look up the reference for you if you'd like, and an email. So you can sure email me and I'll comment about that. And I think it really illustrates the high level of needs that our kids have, and how really it's almost impossible to work and carry out a household and provide for those needs. And certainly what we want is self-efficacy for ourselves and our children. Eventually, we want them to be able to take care of their own needs as they mature, but we also, especially with ADHD, there's developmental delays in executive functioning, and we may have to be involved longer. But I would say in my case too, I couldn't juggle it all. And I did feel very guilty about that. I would look at other families and parents and think, well, they can do it. Why can't I? What's wrong with me? And my husband was very good at pointing out, well, number one, in many of those cases, I have a husband that works very early hours, nights, weekends, and holidays. They all had husbands that didn't start till 9 a.m, so they had somebody to help them in the morning. That was one of the just very simple things. But I pointed out, most of the people I was comparing myself to did not have children with neurodiversity. And so I think it's really important to make sure that we are being kind to ourselves, as Jeremy said. I really like that, Jeremy, and giving some self-compassion. And I have no regrets. I will say that I did get back into the field when my children left the house, empty nest, and you never recapture what you lost in the years that you were busy taking care of kids. But I have absolutely no regrets, and I'm very happy for the opportunity I have now, but mostly happy about my relationship with my kids.
Thank you. So the next question is, are there any tips for a single parent? It seems impossible to take a break.
Yeah, I can imagine that it does. Gosh, in situations like that, I try to recommend parent support groups, and finding other single parents, and maybe doing a swap sometimes where you watch the other single parents' kids and then they watch yours, depending on, everyone's level of comfort with that. But there aren't enough resources for single parents. And, in the study that Jane was talking about a few minutes ago, even, single parents ended up leaving the workforce, and it was devastating to the family because that was the only source of income. And it was very specific about the age of the child when the parent left the workforce. It was right around 9 or 10 or 11, I think. And that just really stuck with me because that's when I left the workforce too. But in terms of other resources, I would check with CHAD, your local CHAD chapter, check with your local Tourette Association chapter or your Learning Disabilities Association chapter and see what they have in place. Because you're right, there's just not enough resources. Jane, what would you add?
I think that was great. Yeah, I agree. I think it's about building your support team. You do need to find a way to build into your life breaks. I'm terrible at that. Something I'm still working on, but you need to put some relief in there. And so whether there's some type of respite you can get, or if you've got very good friends that could go with you to CHAD or TAA and get information on your children, that I like the idea of swapping. We actually did some of that in our household way back. But yeah, that's really it, is building your support network and putting that as a priority, I think, in how you manage your household. You've got to find ways to give yourself a break.
That's good. And I can think of some extreme ones too. I mean, where people have like moved to be closer to extended family. Maybe they didn't ever want to go back to wherever their hometown was, but they absolutely needed more of an external support network. And that was one of the few choices that they had. And, it's not the best case scenario, but it's better than nothing. And same with schools too. A lot of times, I think parents feel like they have to keep their kid in the school that they're in, and you can switch school districts. It's an extreme move. It's not for everybody. And it's not something that everybody is open to trying or able to do. But if you can, you can also apply to your local school board to explain why you want the transition to take place. And sometimes they'll support that as well. I know I kind of devolved into a different question, but I saw something about schools in the chat.
Yeah, there is. Let's see. So the next question is, that was the school. I thought I saw one before that I wanted to ask you. Let's see, sorry, I had it all and then I answered a question and it got all tangled up. Yeah, tips for communicating with school administration who want to sequester ADHD Tourette child in private room during testing to maintain a quiet environment for other students.
Are you talking about securing that accommodation, or?
It sounds like it. I can tell the person here, we do offer support for school here at the Tourette Association. So I'm not quite sure if the question is that they're trying to secure that accommodation, or they want the child with ADHD and Tourette in a private room, and I'm not quite sure. So they're welcome. You're welcome to reach out to support@tourette.org. That I know I put it in the chat. I'm sorry, but it's support, SUPPORT @tourette.org, and ask your question, and we'll be happy to help you get to the bottom of how to help your child at school. And then the next question is, how beneficial would ADD, I don't know if it's ADDL, I haven't heard of ADDL therapy, be for a child with both ADHD and Tourette? Would it be CBT? Oh, maybe additional therapy. Maybe that's what they mean. How beneficial would additional therapy be for a child with both ADHD and Tourette? Would it be CBT or another type?
You want that one, Jane? I can take it.
Take it first. Go ahead.
Okay. So I think the question is, how is your child doing now? If they're doing okay now on their current therapy, on their current treatment, whatever that is, probably not necessarily, depending on the age of your child. I mean, talk therapy is really difficult with, kids even under the age of 10. There's some kids that can do it, but very few kids under that age are self-aware enough to have really beneficial talk therapy. CBT is great. That's definitely one option. I'm hearing a lot of good things about DBT also for kids who have ADHD. Mindfulness training too, I think is helpful also. But again, it depends on how your kid's doing right now, and sometimes that's the best time to engage additional therapies, when nothing major is going on, so you're not in a crisis point. But if nothing's needed, why make your life busier if you don't need to? What do you think, Jane?
Yeah, my mind immediately went to, well, what's the issue? CBT isn't a panacea for every kind of possible problem. So the therapy has to fit what it's meant to or designed to address. The one thing I think we get a lot of here is trauma-informed care and kids having rejection sensitivity dysphoria and related to their ADHD or their Tourette's, or also certain levels of trauma. And obviously I would definitely talk to whoever your behavioral health provider is about what they think might be the best approach for that child. You really have to match the need with therapy. So, and one therapy is not a one size fits all.
Sounds great. I know somebody asked about online support groups, and I did put in the chat. And so I answered the question. I'm not sure if everyone got the answer, but we do offer online support groups here at TAA for families. And I'll make sure I put that in the follow-up email too, because I did have that in the chat. I don't know if you have any other resources, online support, anything else that you want to talk about before we end this wonderful webinar.
Well, I would say I should probably let Jeremy do this one as the board, as a member of the board, but Chad definitely has online support. There's several groups. There's groups for parents. There's groups for adults with ADHD. There's subcategories for comorbid conditions with ADHD. So definitely check out chad.org, the national website, and there's definitely online support groups for those. Most of us with our local chapters are doing a lot of stuff via Zoom as well. So if you're in a specific area, you can go to Chad and look up the geographic region and find out where your closest affiliate is.
Good. That's exactly what I was going to say. Also, there's a lot of Facebook groups that offer, online support or support within the group. You want to choose wisely and definitely, check to make sure there's a moderator and things like that, because those things can go downhill sometimes if someone's not closely monitoring that or it's not a real positive, well-organized group. But, Facebook has a lot of groups like that offer free support as well. But Chad is the go-to. Chad and, the Tourette Association are the go-tos for sure.
Yeah, we both offer online support, both organizations. So that's great. I'm sorry, a question came at the beginning of the webinar, and so I skipped over it, and the person just reminded me. This is a person who'd like you, if they're wondering if you could discuss some of the inappropriate behaviors that adults with Tourette and ADHD may exhibit. And I'm asking because I saw in both of your bios that you do a little work with adults. So I thought maybe you might be able to approach the subject a little before we hop off.
Jeremy, I don't have a lot of, my daughter has pandas. So the Tourette's is not, it's a forte for me at all. So I'm gonna let Jeremy address that. I do have some thoughts on adult ADHD, but go ahead, Jeremy.
Yeah, I guess I'm not sure to what end discussing inappropriate behaviors. My guess is that for the most part, they're not dramatically different than the behaviors exhibited by our kids with ADHD and Tourette. But I'm not thinking of anything specific. Is there a specific area that if you're still on that you wanted us to touch base on, like in terms of like addiction or something else?
Yeah, I don't have anything specific, but maybe the person who wrote the question will type something else in, because I was wondering that too, if there was some kind of a specific behavior, something inappropriate that they were referring to.
Yeah, so I hate to just like throw random stuff out. I mean, I can, but that probably wouldn't be very ethical.
Yeah, I think the person that's writing this, I'm going to ask, could you reach out either support@tourette.org? I gave that earlier, or you're welcome to ask your question to Jane or Jeremy as well. I think that would probably be the most appropriate place to address it, since it's adult in Tourette. And we do have webinars and information for adults in Tourette, and you can look for that in future programming as well. So on that note, it looks like we have all of our questions, and I so appreciate you, Jeremy and Jane. Thank you so very much for this super informative, kind of life-saving webinar, right? We all need these tips. It is kind of life-saving for parents. So thank you so very much for working with us here at the Tourette Association. We more than appreciate you, and I'm sure the people on tonight did too.
Thank you for the opportunity. It's such a privilege. Thank you so much.
You're so welcome. Have a wonderful night, both of you and everybody who tuned in. Thank you for tuning in. And from the Tourette Association, thank you to everyone.
Thank you.
Have a great night. Bye-bye.